From the outside, a phobia looks simple. You just don't get on the plane. You just look away from the needle. But from the inside, the world closes in. That single point of intense fear dictates how you navigate your entire life. People skip family reunions across the country, turn down major job promotions, and map out unnecessarily long routes just to avoid a specific bridge or highway. This intense, irrational dread is remarkably common, affecting approximately 9% of adults in the United States. Unlike generalized anxiety, a specific phobia acts as a localized, invisible barrier. It forces people into a shrinking box, actively draining their autonomy and restricting where they can go and what they can do. Clinicians define this condition strictly. For a fear to be diagnosed as a specific phobia under the DSM-5, the intense anxiety must persist for at least 6 months, and the reaction must be completely out of proportion to the actual danger present. These triggers generally fall into 5 main categories: animals like dogs or spiders, natural environments like heights or storms, blood and injections, situations like enclosed spaces or elevators, and a final category covering triggers like choking or loud sounds. Here is the hopeful reality of the condition. While it causes profound daily impairment, specific phobia is one of the most treatable anxiety disorders in modern psychology. So, if a reliable cure exists, why do millions of people remain stuck in their shrinking worlds for years or even decades without ever getting help? The answer lies in how the brain processes relief. When a person encounters their specific trigger, their nervous system sounds a massive, immediate alarm, flooding the body with panic. To escape that overwhelming physical distress, they will accept almost any penalty. Walking up 20 flights of stairs feels like a reasonable alternative to stepping inside an elevator. Illustrates what happens next. The second they step away from the trigger, they experience a sharp drop in anxiety. This reward tricks the brain into believing running away saved them, reinforcing the fear. Loved ones often cement this cycle by accommodating the phobia. Avoidance serves as the mechanical engine of the disorder, actively fueling the fear's survival. To stop the engine, clinicians use exposure therapy. This is a systematic, evidence-based method for dismantling that behavioral loop, rather than an arbitrary test of willpower. The most common form is in vivo exposure, which involves gradual, carefully planned encounters with the actual feared object in the real world. For situations difficult to practice in a clinic, like flying or extreme heights, therapists use virtual reality simulations to safely recreate the environment. Clinicians also use interoceptive exposure. This targets phobias linked to the fear of physical sensations, safely replicating bodily responses like a racing heart right in the office. There are even highly effective single-session treatments where massive, prolonged exposure over 3 to 5 continuous hours yields rapid, measurable results. Regardless of the specific method, the goal is mechanical. By staying in the situation and surviving the trigger without escaping, the brain is denied its relief reward. The loop short-circuits and the phobia starves. Because this approach targets the mechanics of the fear directly, targeted exposure therapy produces durable results quickly, frequently within just 8 to 12 sessions. This rapid intervention becomes critical when a phobia crosses the line from a daily inconvenience into a clinical emergency, a threshold that warrants a priority referral. These priority cases include severe blood and needle phobias that block patients from getting vital vaccinations or surgical clearance, or choking and vomiting phobias that severely restrict a person's ability to maintain basic nutrition. Severe situational fears, like driving or flying phobias, also require immediate attention when they completely eliminate a person's employment opportunities or their ability to travel for specialized medical care. Targeted therapy restores what the phobia took away: access to medical care, professional advancement, and the autonomy to travel. Many people delay seeking help because they assume exposure therapy sounds awful, they worry about the cost, or they feel embarrassed by the specific thing they are afraid of. The first step toward recovery is a safe conversation with a professional, allowing you to discuss the fear before you ever have to confront it. Coping and healing counseling provides exposure-informed telehealth therapy to residents across all 159 counties in Georgia. Their diverse team of licensed therapists is fully equipped to guide this process. They remove the financial barriers by accepting major commercial insurance plans like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana, and they offer a $0 copay for Medicaid patients. If a specific fear has been shrinking your world, it is genuinely treatable. Reach out to Coping and Healing Counseling at chctherapy.com or call 404-832-0102 and take the first step toward expanding your life again.